Hello everyone and welcome back to our channel. Hey, today we're going to dive into an important topic that affects millions of people around the world, which is blood sugar monitoring. Now, you may be living with diabetes or maybe you're just interested in maintaining a healthy lifestyle, but really at the end of the day, understanding the importance of blood sugar monitoring is critical. So before we get started, make sure you smash that subscribe button and click on the bell notification icon so you never miss our new content. Also, if you love it and you want to see more, click on that thumbs up and let us know that you want more. So let's begin. Let's talk about why blood monitoring or monitoring your blood sugar is so essential. You see, blood sugar is the primary source of energy for our bodies. When our blood sugar levels are within a healthy range, we feel energized, we feel balanced. However, it can fluctuate, and these fluctuations in blood sugar can have serious consequences. Uncontrolled blood sugar can lead to various complications, especially for individuals with diabetes. You know, there's something called high blood sugar, which is known as hyperglycemia. It can cause symptoms such as increased thirst, frequent urination, fatigue, even long-term damage to organs like your kidneys and eyes. I mean, you can actually go blind by having too much high blood sugar for too long of a time. On the other hand, low blood sugar or hypoglycemia can result in shakiness, dizziness, confusion, and in severe cases, loss of consciousness. Now, you might be wondering to yourself, like, how often should you measure your blood sugar? Well, it's a good question. The frequency of monitoring really depends on factors such as your overall health, what kind of medications you're on, and the type of diabetes you have. Generally, people with type 1 diabetes or insulin-dependent type 2 diabetes may need to monitor their blood sugar multiple times a day, especially before and after meals, physical activity, and before bedtime. I personally like doing one after every meal and then also one first thing when I wake up in the morning. However, it's always best to consult with your healthcare provider for personalized recommendations. Now, moving on, let's explore the different methods of blood sugar monitoring because there are a couple different ways that you can do it. The first one, traditional method, and the most common method, has been the use of glucose meters. These devices require a small blood sample, usually obtained by pricking the end of your finger with a lancet. Now, the blood is then applied to a test strip and the meter displays your blood sugar levels. Now, it's a great way of doing it, but it gets kind of literally a pain, you know, jabbing your fingers all day long. In recent years, technology has advanced, and now we have another option, which is called continuous glucose monitoring, or CGM. CGM systems use a small sensor, usually inserted right under the skin on the back of your arm, and it allows you to measure glucose levels continuously. The sensor sends real-time readings to a monitor or smartphone app, allowing you to track trends, set alarms for high or low glucose levels, and make informed decisions about your diet, exercise, and insulin doses. And there's actually a third way. It's a newer emerging technology called flash glucose monitoring, which provides glucose readings by scanning a sensor with a reader or a smartphone. These methods eliminate the need for finger sticks while providing valuable data to help manage your blood sugar levels effectively. Now, it's important to understand I prefer going with the continuous glucose monitor, right? I'm using the Dexcom G7. We'll do that review in another video. But let's talk about what typical blood sugar levels should look like for a person with type 2 diabetes. The American Diabetes Association recommends aiming for the following ranges. If at fasting, when you wake up in the morning before, but you've had time and not eaten for 8 to 12 hours, you should be between 80 and 130 milligrams per deciliter. Now, after you eat a meal, you should be still below 180 milligrams per deciliter. However, it's important to note that target ranges may vary depending on your own circumstances. Your healthcare provider will provide personalized guidance based on your specific needs. Now, in conclusion, monitoring your blood sugar is a vital aspect of diabetes management and overall health. Whether you choose traditional finger stick meters or continuous glucose monitoring systems or other methods, the goal remains the same: to maintain stable blood sugar levels and prevent complications. Remember to work closely with your healthcare team to determine the best monitoring strategy for you. That's all for today's video. If you found this information helpful, don't forget to give this video a thumbs up and subscribe to our channel for more health-related content. As always, stay proactive about your health, and we'll see you next time. Keep that blood sugar in check.